Well, let's read the parts of the leaflet, which tells patient about this procedure, gastroscopy. And the first part of the leaflet is, you can see on the slide, and let us listen to Asna. Read it, please.
Yes, ma'am. What preparation do I need to do? The hospital department will usually give you instructions before your test is commonly included. First point is don't eat for 4 to 6 hours before the test. The stomach needs to be empty. The small sips of water may be allowed to up to 2 hours before the test. And next one is if you have a sedative, have somebody accompany you home. And next one is if you are taking any other medication, tell your doctor. It may need to be stopped before the test.
Okay, so you remember that we were listening to the description of this procedure. That is why there is nothing new for us about the procedure, just to focus how it should be explained. Next slide, please. Shamisha.
Yes, ma'am. What can I expect after a gastroscopy? Most people are ready to go home after resting for half an hour or so. If you had a sedative, you may take a bit longer to be ready to go home. The sedative will normally make you feel quite pleasant and relaxed. However, you should not drive, operate machinery, or drink alcohol for 24 hours after having the sedative. You will need somebody to accompany you home and to stay with you for 24 hours until the effects have fully worn off. Most people are able to resume normal activities after 24 hours.
So I think everything is also clear here. And the next piece of information is for Ramisha.
Yes, ma'am. Is gastroscopy reliable? Gastroscopy is a good test for seeing abnormalities in upper gut. However, it is not foolproof. For example, gastroscopy may not detect a small number of cases of AD ulcers or AD cancer.
And then, please, John Farvin. John Farvin? Is she here? John Farvin? Hello. No, John Farvin. So this is minus. Hala Malik, please.
Are there any side effects or complications from having a gastroscopy? Most gastroscopies are done without any problem. Some people have a mild sore throat for a day or so afterwards. You may feel tired or sleepy for several hours if you have a sedative. There is a slightly increased risk of developing chest infection or pneumonia following a gastroscopy.
Okay. Well, the next piece of information is for Sultan.
Yes, ma'am. Leaflet about gastroscopy. Occasionally, the endoscope causes some damage to the gut. They may cause bleeding, infection, and rarely perforation. If any of the following occur within 48 hours after gastroscopy, consult a doctor immediately. Abdominal pain, fever, difficulty breathing, vomiting, blood. A small number of people have a heart attack or stroke during or soon after a gastroscopy. These serious complications are rare in most people who are otherwise reasonably healthy.
Okay, don't forget about the stress when we say gastroscope. the stress is on gastroscope. But if we speak about procedure, this is gastroscopy. Yes, gastroscopy. Okay. Now, when we've read all the information which is given in the leaflet, so let us try to answer the questions which are given here on this slide. Sindhu, please, the first question is for you.
What do you need to do for 4 to 6 hours before the procedure? Before the procedure, the patient must not eat for 4 to 6 hours, and the patient is only allowed to take small sips of water before 2 hours.
Okay.
Like hours, before 2 hours, the stomach must be empty, so the patient is not allowed or drink anything.
Okay, great. Okay. So then, Danish, please.
Yes, ma'am. How will the sedative make you feel? The sedative normally make a person feel quite pleasant and relaxed.
Okay. Well, and Ashwati?
Yes, ma'am. What should you not do for 24 hours after the sedative? You should not drive or operate machineries or drink any sorts of alcohols after having the sedative.
Exactly, because this is dangerous. Okay. So the next is for Taib.
Yes, ma'am. What do you need after the operation? We need rest, ma'am. We should take enough rest.
And if a person needs to go home,
Yes, ma'am.
what
He needs to go home.
does he need any person to help him?
Yes, ma'am.
Yes.
Need a
Okay.
person to help.
Okay, then Labib, please.
Yes, ma'am. How successful are the results of the test? So most gastroscopies are done without any problems, and also some people may have some mild sore throat for a day or afterwards, and also they feel tired or sleepy for several hours. And also gastroscopy is a good test for seeing abnormalities in the upper gut. And also sometimes it may causes some damage to the gut.
You've answered the last question, but how are the results? Are the results of the gastroscopy reliable? So can we trust the results?
Yes, ma'am.
And what does it say? What does the leaflet say about the results? What does it say? It's here that it's not foolproof, right?
Yes, it
Because
is not a full. So it may not detect a small number of cases, early ulcers or early cancers.
Okay, so we need some more tests to get more about these diseases. Okay, so good. And now when doctors speak about procedures, doctors use the adverbs of frequency in their description. Now let us find the adverbs of frequency in the sentences and put them in the order starting with the least frequent. So what is the adverb of frequency in the first sentence? Procedures like this are usually done under sedation.
Usually,
yes.
Usually.
Then we often get patients who have no complications.
Often.
Okay, often. Fortunately, we have never had a patient who has had serious complications with this procedure. Never. Right. Okay. The procedure rarely goes wrong.
Rarely.
Rarely.
Yes, you're right. It always takes me a while to recover from the anesthetic.
Always.
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 While
Patients, yes, patients sometimes get a headache afterwards.
Sometimes.
Okay. And if we
Sometimes.
think, yes, if we think about the order of frequency, that these adverbs describe. If we start with the, let us say, starting with the less frequent. The less frequent adverb here is never, right? Then what goes next after never?
Rarely.
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 Then sometimes.
Okay.
Patient sometimes get it.
After sometimes.
Often.
Often. Then
Usually.
and
Always.
always. Okay.
Always.
So yes, we have this order of sentences. Yes, and instead of these words, what else can we use? I mean, what synonyms do we know about? Synonyms for the adverbs do we know? Synonyms to rarely. Synonyms of
Hardly.
okay.
Not
Okay.
often.
Not often. Okay. Synonyms to sometimes.
Seldom.
Yes.
Barely.
Sometimes, rarely. Okay.
Seldom.
Seldom. Right. Synonyms
Not often.
often. Often.
Frequently.
Frequently,
Okay.
regularly,
Yes. And usually?
Typically.
Generally. Common.
Generally.
Generally.
Commonly.
Okay. Right. Here they are. So, for example, sometimes now and then. Okay. Now we are going to discuss the complications of the procedure. And so what are the complications of a gastroscopy? What are they? We've read the information on the leaflet. What are they? Yes, Halamalik?
Mild sore throat.
What else?
Abdominal pain.
Exactly.
Infection. Chest infection or
Headache after
pneumonia.
sedation.
Okay.
Vomiting.
Bleeding, vomiting sometimes. Yes.
Headache after sedation.
So, good. Thank you. Now, let's listen and list the complications that the doctor mentions, and so make notes about them, about the complications. Well, now you'll tell me if you can hear.
Listening 4.
Can you hear?
yes, ma'am.
Now, please.
Yes, ma'am.
Listening 4. Now, I just have to go through some possible side effects of the gastroscopy, if that's okay with you.
Yes, fine.
First of all, I can assure you that in most cases the procedure is problem-free, but I have to point out to you some side effects so that you are aware of them before you sign the consent form. Is that okay?
Yes, fine.
Right. Well, some people can have a mild sore throat for a day or two after the procedure. And if you have been given something to make you drowsy, you may feel a bit tired afterwards as well. And some people can get a chest infection or pneumonia. But remember, this does not mean that you will necessarily get these as well.
Okay, I hope not.
And on the odd occasion, the endoscope can cause some bleeding or infection in the gut and can also puncture the gullet or stomach, but this happens very rarely.
I see.
Is there anything that you would like to ask me or go over again, or are you okay with all this?
So what does she mention? As we've already said, the first was sore throat, right? Then?
Yes.
What else?
Then drowsy, feeling drowsy.
So
feeling
feeling drowsy,
Chest
tired,
infection,
It's tired.
chest
Chest
infection,
infections or pneumonia.
chest infection,
Bit tired after
infection in gut,
yes,
Bleeding.
bleeding, puncture, yes. Okay. And what phrases does the doctor use for instead of occasionally, automatically, and seldom? Did you notice?
Rarely for seldom.
Yes, she says rarely for seldom. What about automatically?
sometimes for occasionally.
Not occasionally, she says on the odd occasion instead of occasionally. And instead of automatically, she uses
necessarily,
necessarily. She
given-
says not necessarily means. Yes, you're right. Okay.
Listening for.
And now let us focus on the 3 ways the doctor makes the complications less threatening. So let's listen one more time and just make notes about these 3 ways. Okay.
Listening for.
Now, I just have to go through some possible side effects of the gastroscopy, if that's okay with you.
Yes, fine.
First of all, I can assure you that in most cases the procedure is problem-free, but I have to point out to you some side effects so that you are aware of them before you sign the consent form. Is that okay?
Yes, fine.
Right. Well, some people can have a mild sore throat for a day or 2 after the procedure. And if you have been given something to make you drowsy, you may feel a bit tired afterwards as well. And some people can get a chest infection or pneumonia. But remember, this does not mean that you will necessarily get these as well.
Okay, I hope not.
And on the odd occasion, the endoscope can cause some bleeding or infection in the gut and can also puncture the gullet or stomach, but this happens very rarely.
I see.
Is there anything that you would like to ask me or go over again, or are you okay with all this?
So what is the first phrase that the doctor uses to help the patient to understand the procedure and to feel comfortable with this?
Mild.
He said most cases are problem free.
Problem free.
Yes, it's problem free. Yes. That's okay. Then
And not mean that you
Not
will necessarily get it.
yes, so remember, this does not mean that you necessarily get these complications. And one more way she
Very
uses
rarely.
Rarely.
These
Yes.
happen very
This
rarely.
happens very rarely. So it illustrates how we should keep reassuring the patient just to make him understand the procedure and sign the informed consent.
Listening for.
Well, and now we are going to speak about emotions. When doctors see a patient showing emotion, they can make a comment or observation. This is called acknowledging a visual cue. And if we have a look at this slide, so we can see the pictures and some statements that illustrate, or the statements and the pictures that illustrate the emotions of people. And the task is to match each picture with a statement. Let us read the statements and just understand which picture it describes. So, well, Taib, please. Taib, are you here?
It's better.
Sentence
Yes, ma'am.
number 1.
It's better to let it all out rather than bottling it up.
So, which picture is it about? Let it all out, not to keep it in, not to bottle it inside. So who can help us? Which picture is this?
C.
C, yes, it's picture
Option C.
C. Yes, when the person is crying. Okay, so Labib, please, the second sentence.
Yes, ma'am. You look very happy to be going home. Option D.
D, yes. So the person is happy, okay. Hepsiba.
I can see you are a bit alarmed by the procedure. F.
Okay, let it be F, if you say. And Ansila?
You look rather nervous about this. It can be F or
yes.
A.
Yes, and if we compare these two pictures, F and A, where the person looks alarmed and where just nervous.
In F, the person is as he's biting his nails.
Yes.
And A, the person is alarmed.
Alarmed, yes, because he shows stronger emotions. Okay, so Asna, please, the next sentence, number 5.
I can see your pain. You are in pain. E.
E, yes, the person is in pain. And Shamisha.
You look a bit confused by what I have said.
Picture?
B.
Picture B, the person is confused. Well, here we have some sentences. So the sentences from the previous slide are given to the left. And there are some additional sentences, some additional comments that the doctor gives in these situations. Let us match the beginnings and the next phrase, which is said by the doctor, the most suitable development of the conversation to reassure the patient. So, who was the last person to speak? I don't remember.
Shamisha, ma'am.
Shamisha, okay. So please, Ramisha. So read the first set of sentences.
It's better to let it all out rather than bottling it up.
And what is the next phrase in this situation?
It won't take long and it's painful.
Okay. Okay. Can we use like this? But we'll soon give you something to help you relax. So there is no need to worry, right? So also possible.
Yes.
Okay. So the next situation, John Parvin, please. Number 2.
Yes, ma'am. You look very happy to be going home.
And the next phrase.
So, would you like me to go over it again for you?
But the person is going home. So, what is
ma'am, so I won't keep you long.
Exactly. Okay. So Hala Malik, please. Number 3.
Ma'am,
I can see you are a bit alarmed.
I uh, uh,
Mhm.
but but remember, you are very lucky. We caught it early.
Okay, yes, it's possible to say in this situation. Okay, Sultan, please. Number 4.
Fourth one, you look rather nervous about this. Would you like me to get you something?
Okay. Any other possible development of the situation? What else can the doctor say? Is it possible to use, but it won't take long?
Take long. It's pain-free. Yeah.
It's pain-free. Yeah. So the next is for Sinju, please.
I can see you are in pain. Would you like me to get you something?
Just some painkiller. Okay, and Danish.
Yes, ma'am. You look a bit confused by what I have said. So, would you like me to go over it again for you?
Just to explain the procedure one more time. Yes. So this is the way the doctor speaks to reassure the patient. And in your own country, what would you say to a worried patient, or what would you do? So, Sinju, can you comment on this?
Yes, ma'am. Usually in our country, when a patient comes for a test, usually that patient may or may not have done that test before. So the patient, there's a high chance that gets alarmed or patient gets nervous when the doctor explains this. So the doctor usually tries to interact with the patient more and to find where the tension where the nervousness is there, like in which portion or in which procedure in the whole procedure makes the patient so nervous. He would try to explain it in more detail so that the patient gets less nervous and can understand the whole procedure.
Okay, thank you. This is what we were speaking about, right? And in your country, do people just tend to show their emotions or to keep them inside? Yes, Hala Malik.
They're very expressive.
Mostly
Very expressive.
Ma'am, they're very expressive.
Very emotional. I see.
Yes, ma'am.
I
They
see.
in hospital, if even if there is a large queue or large patients are waiting, some of them may get impatient and react there itself. So they are highly impatient.
I see. Okay. Well, and yes. Now we'll start speaking about home assignment. Here on this slide, you can see the names of different tests and procedures. So colostomy, ERCP. Don't ask me to read this long word. It's very hard for me because maybe I do not understand what this long word, what parts this long word consists of. You are the experts in this, and you can easily just read. Maybe not very easily, but try to divide it into parts and pronounce the name of this procedure. The next is bronchoscopy, then heniorrhaphy, then blood test, and then chemotherapy. So you should prepare a leaflet that gives the patient information about these procedures and tests. And you see that we will do like this. We'll prepare a PowerPoint presentation with the steps that are described in the leaflet. And you should keep the information. You should follow the leaflet that we've read today. And and you should follow some points which are presented here on this slide, like use bullet points if necessary, and make no more than 5 slides in total. Write about each complication separately, and use the following words and expressions to help you. Like sometimes, occasionally, rarely, some people. There are some people, not everyone. And try to use the present simple, active, and passive, and the imperative for actions, and the structures that we were speaking about today to make to sound more reassuring to a patient. So this is the task. The task is on the Moodle site, and so you remember that the deadline for task is Saturday night, and you should prepare. You should make the presentation and upload it to the Moodle site into the folder. And yes, and be ready. Just you'll upload the presentation by Saturday, and you should be ready to speak about this procedure using the slides of the presentation next class. So we'll start with the next class. We'll be listening to you, and you see that there are only 6 procedures given, and there are how many? 13 students in the group. It means that so you you should be working in groups of 2 or 3. Yes, one group will consist of 3 students, and you should decide who you are going to work with, or Sinju may just divide the class into pairs, and one group is 3 students. Okay, Sinju?
Okay, ma'am.
So of course you should ask the patient, the students, who they would prefer to work with. Okay, do you have any questions? Okay.